Hi, my name is Hillary and I'm the owner of New Age Psychiatry. So today I wanted to talk to you about attention deficit disorder. If you're watching this video, you may have noticed or you may have felt that you may have this condition. And I wanted to give just some key points. So untreated ADHD can manifest in many ways. You may seem anxious, you may seem irritable, you may seem depressed, you may have mood swings, and you may be treated for a condition that's not essentially those conditions. So what distinguishes ADHD from other conditions is typically the age of onset. So if you noticed when you were a child that you were daydreaming constantly, you were hyperactive, these symptoms should have been present or have most likely been present before age 12. As an adult, they may present more as inattention and procrastination, low motivation, falling behind on deadlines, missing details, maybe switching jobs frequently, being restless, not able to sit down and communicate with people for extended periods of time, interrupting people. There is a mixture of hyperactive versus inattentive symptoms that may present. But if you feel like this is one condition for you, then let's look deeper into the possible treatment options. So stimulant medications are the most effective treatment for ADHD, and they have about an 80% efficacy rate. Non-stimulant medicines, which are typically tried first by doctors who are not specializing in psychiatry, they are essentially Wellbutrin, Strattera, Intuniv, which is blood pressure medicine, which is actually only approved in adolescent populations. So these medicines typically don't work. Wellbutrin may help with depression if that is an issue, though. However, Strattera has to be dosed twice a day in case you only took it once a day. So that is because of the short half-life. So if there is, if you tried a non-stimulant and it did fail, which is actually not that common, then a stimulant medication would be the next choice. The stimulant medications come in basically two forms. They've all been shown to be equally effective, and it really depends on a trial basis to see which one works best for you. And it's random to see which one does, so you do have to try them. They only differ basically in long-acting versus short-acting formulations. Short-acting formulations will stay in the system about anywhere between 3 to 6 hours, and you have to take it twice for it to cover a full workday. The long-acting ones come in a capsule form, and they release when you digest them throughout the day, maybe half in about an hour after you take it, another half maybe about 4 to 5 hours after the first coating of layer degrades. So the benefit of the long-acting medicines is that you only take it once in case you forget your pills. It's typically better tolerated, a little bit smoother as far as the release of the medication goes, and people have some people have varying symptoms as far as which one they prefer. Some people like the fact that it comes on a little bit slower, leaves slower, and they only have to take one pill. Other people prefer the short-acting formulation simply because they don't want to be on a medication the entire day. Maybe they want 4 hours of focus, and then that is it. They don't need necessarily to focus too much because their day job is very strenuous, but they are physically demanding. They don't really need to be necessarily sitting down and paying attention to small details. But they do want to take their pill, say after work, when they have to study for 4 hours, say if they're in school. Those are just a couple of examples. So, and then as far as co-occurring disorders go, I have found that people who have ADHD and also depression or also anxiety, as long as the depression and anxiety isn't prominent, meaning that the depression is so bad that you can't get out of bed, you are feeling suicidal, you have no energy, or the anxiety isn't overbearing where you're having panic attacks on a daily basis, then I do prefer to treat the ADHD first. And that is because untreated ADHD can manifest as other disorders, because let's say you are procrastinating, you forget your deadline, you give yourself anxiety, you put yourself down. If this happens on a constant basis, you may develop some depression or anxiety just because of the fact that you're not, the ADHD symptoms are so prominent, they're interfering with your functioning, and then you in turn give yourself these other anxiety symptoms. So those are just some basic key points that I wanted to give you guys. And if you are wanting to be a patient or be evaluated, there is a risk-free evaluation where if you're not happy with the diagnosis, you feel like you can get the right treatment, or I'm not the right provider for you, we can refund you fully. So it's a risk-free evaluation. And that typically doesn't happen. So I'd love to meet you guys. Bye.